Hello, everyone, and welcome to the next installment of Child Life in Action COVID-19. In this series, we are interviewing child life specialists to discuss the impact coronavirus has had on their work and some of the unique and innovative ways they are adjusting to the new demands the situation creates, both personally and professionally. I'm Meagan Roloff, Director of Member Engagement and Partnerships for ACLP, and today I am happy to be joined by Debbie Spencer. Debbie, can you go ahead and introduce yourself, where you work, and what your role is?
Absolutely. I work at AdventHealth for Children in Orlando, Florida, and I am the clinical coordinator for our child life team. I also cover part-time our pediatric cardiac intensive care unit, but mainly a lot of my responsibilities fall under supporting our internship program.
Fantastic. Now, internships have been a hot topic in the community. A lot of sites experiencing disruptions because of COVID-19 cases in their area. Can you tell us what the current status of your interns are?
Absolutely. We had to unfortunately send our interns home. We had two. I came into an email on a Tuesday morning that said all students have been suspended indefinitely, and I kind of knew it was coming, but was also very sad for that to happen because they were at week 11 in their internship. So we're over that halfway point, and I'm starting to make some really good progress, but definitely had to go with the organization's rules. So we had to send them home. One has physically gone all the way back home. He was from out of state, and the other one lives here. So there's a lot of disruption for sure.
Yeah, and so that decision-making process happened entirely at the system level, and was just one of those things you came into and had to hear the news.
Yes, we're a large hospital with a lot of students, and so there wasn't any input from little old me.
No, that's tough to have to be the one to deliver that message. So I'm sure not the easiest day.
Nope.
So the reason why I wanted to speak with you today was because you had posted on the Internship Coordinators Forum about some really innovative ways you're keeping your interns engaged during this disruption when they can't be on site, when one of them's gone out of state back home. Can you tell us a little bit more about what you're doing?
Yes. So honestly, the inspiration came from one of my interns. After I had told her she couldn't come back, she said, well, I still want to do everything that I can to stay engaged. And that got my wheels spinning of, okay, what can we do? I definitely work in a program of what can we do in the situations. So we decided to keep going with any of the activities or assignments that they would have been doing at home. So articles to read and review, any papers that involve multidisciplinary team members that they would have interviewed. They're now sort of just doing more research rather than an interview of what that role is, and then talking about how they had seen that work happen in collaboration with Child Life while they were here, or kind of hypothesizing of how they could see that. So we're adapting those assignments to make it work in their current situation. We meet twice a week via a Zoom call to also work on new assignments. So I created essentially a fake census, and I sent it to them ahead of time and said, okay, prioritize the patients in the order you would see and why, give the rationale of why you would see them first. And then also, what more information would you need to know to help make these decisions? So really doing a lot of critical thinking of essentially you walk into your job, this is trying to mimic the real life world of child life, but here's your census, where do you start? And what more information do you need? And then additionally, I asked them to pick 5 patients and describe the interventions or education that they would be providing based on the information that they had, their age, and some of the risk factors that they were considering. So it was definitely a more in-depth for our first time meeting, but they really enjoyed it. They said, wow, this was a lot harder than I thought it was going to be, but it got me thinking about child life again and in the mind of child life while I'm sitting here at home and keeping all of my skills fresh. So that was one of the things. We've also done an article review where they read the article. They did, it was on self-care. And so, which I thought was pretty appropriate during this time. And then we just had an open discussion about what they read and different practices that we're all doing at this time. We're also continuing with our weekly education sessions. So while they were here, they would meet once a week with different team members to discuss different topics. This week it happened to be diabetes education. So yesterday they met via Zoom, and our team member did her presentation, and they engaged in conversation around it. So that was one thing we can continue doing. And now tomorrow we're doing role playing. So I've given them scenarios of preps that I want them to think about, the ages, and then I'm actually going to be using our puppet, and we'll be doing some role playing that way. I may also, since they have some in advance, I want to give them some real time. Okay, now also you have this going on during that conversation to kind of keep that real life sort of aspect going too, because we don't always have 3 days to prepare for a preparation. So
right.
So yeah, trying to model and just be creative and think about what can we do to keep them thinking, and so that when they do come back, they're not at a bigger deficit that they're already going to be just because of the lapse in time that they physically haven't been here.
Sure. Now, this sounds like it's been a lot of work on your part to get all of this set up and going for them remotely. How are you managing, this new way of engaging interns while also navigating what I'm sure is a number of coronavirus related changes within your hospital, how your team on site is functioning?
So we have had to change some of our staffing. Thankfully, our organization feels that all healthcare team members are essential, so they want us to be working. So we are all still here. We've expanded our hours and kind of divided up different responsibilities as our census has been a little bit lower. So that's, I'm kind of in a very unique and blessed position where I've been given more time to be able to devote to our interns and supporting our team members. So I know that that's not true for everyone. So I do recognize that it's not a luxury, it's a blessing for me to be able to do this. However, it sounds like it's a lot more work, but it's really kind of what we were doing already, and just making some small tweaks to how we can still engage them and make it real and actually applicable so that they can still learn.
Sure. Do you have any advice for other programs that would maybe want to start something like this with their interns?
I would say start small. Start with maybe a weekly conversation and get ideas from them. I'm sure they're all thinking, that's, like I said, it came from one of my interns of, I still want to do all of this. So don't just assume that students are like, okay, I can't be there, so I'm just gonna, self-quarantine at home and not do anything, because they worked so hard to get to where they are. So I feel that it's our responsibility to look at ways we can still engage them. I think that's one of the great skills of child life specialists is we are so wonderful and at adapting to changing environments and stressful situations. So I think we can apply that to our students as well. And, just because a hospital says they can't be here, what else can we do?
Yeah, that's one of the things that all of us on the ACLP staff continue to be blown away by is the flexibility and creativity of the child life field. And, it was always there, but I think this situation in particular is challenging that skill set, and people are rising to the occasion in incredible ways. So yourself included, really amazing work being done. On a more personal note, how are you managing with all the changes that this has brought? How are you sustaining and taking care of yourself? I think self-care is a really big topic in our field right now as well. And just kind of wanted to check in with you on a more personal note as well.
Yeah, it's definitely, I just keep saying it's a weird time. Everything is weird. In Florida right now, we're kind of in this waiting, very prepared mode. We are, not really seeing much in pediatrics, but we're very ready. And so my team is just an amazing source of energy, and we're getting creative with our patient interactions and supporting children of adult patients and virtually, and how do we get there. So it's really this very creative time on our team, and that fuels me as we look at innovative ideas. And then outside of work, I'm getting outside. It has been beautiful around here. The weather's been perfect. So we go on walks at night, and I also bake. So anytime I have some time, I'm baking, which also my team benefits from. So
Well, that's wonderful. I don't want to take up too much more of your time. I know, the entire child life community is very busy right now. So I think we'll leave it there. But just thank you again for the work you're doing to keep your interns engaged and for sharing more about that work with the entire community. I really appreciate you taking the time to speak with me today. And on behalf of everyone at ACLP, I hope you, your team, your loved ones are all staying well.
Well, thank you. And thank you for all the work that you guys are doing as well.
Thank you.